Hi, everybody. So I have with me today Dr. Ryan Wilk, and he is owner of Ryno, right? Ryno Chiropractic here in Peoria as well. So tell us a little bit about your practice and you.
Excellent. Melissa, thank you so much for having me
Of
on.
course, of course.
Well, it's a beautiful Friday, first and foremost. We're just getting ready for Labor Day weekend, second, so we're going to have a great weekend. My practice is located in North Peoria, Arizona. We're on Lake Pleasant and Happy Valley for all of you local people. We started about 5 years ago now. We're going on our 5th year anniversary, and in our office, really, we started from nothing, first of all, and we really had to find a niche and people to connect with in order to grow. And the coolest thing was we found that pregnancy and taking care of kids was our in and our niche. And we've kind of grown from there. So we are a family chiropractic office. We take care of kids. We take care of teenagers going through sports. We take care of expecting moms. We take care of the weekend warrior gym rats. We take care of the elderly and anybody in between. And it's really a fun and awesome environment. I picked this area mostly because this is where I grew up. So I went to school in Peoria, Arizona. Obviously not chiropractic school, but went to elementary school and high school in Peoria, and just came back home and really wanted to serve my community and serve the people that I kind of grew up with, because I actually have a lot of those that I went to high school with. So it's been an awesome transition. These last 5 years have been great, and we keep growing and growing. We actually have another doc in the office now too. Yes. So the office is expanding and growth is happening.
I got to meet him.
Awesome.
He was amazing too. Both of you guys are just amazing.
Yeah, his name's Dr. Nick, for all of you locals.
Yes, yeah, and you don't meet very many people who were born and raised here and then come back. Most of us are transplants. Yes. Linda, as you guys know, the co-owner, my good friend here, she also born and raised. So love you guys, love the locals. Yeah. Okay, so first, what is the number one thing that you wish people knew about chiropractic work?
The number one thing is probably the misconception of chiropractic. The misconception of chiropractic is that the only thing we see people for is pain. And while that is true, and people find our office in pain and having some sort of discomfort or experiencing something specific that happened to them, most of the time that's not the reason people stay. Yeah. So the biggest thing I want to let people know about chiropractic is it's really about optimizing function. Okay, and so in chiropractic, we stay in our lane, and that lane is neuromusculoskeletal kind of conditions and making sure your nerve system is uninterfered with. So if we can start with a base of having a solid foundation of a great nerve system where our brain is communicating with our body, then we can build off of that in so many different ways. And we can talk about nutrition, we could talk about exercise, but there's also specialists that you can go to for that. And so chiropractic, I view it as that foundation for which to grow off of. So if we want to build immaculate health and we want to be healthy for a long time, we need to make sure the foundation is solid. Just kind of like if you're building the tallest skyscraper, you need a super solid foundation. Where if you need to build a one-story house, maybe it can have a couple cracks in it here and there, even though we don't want those. But I think the biggest misconception is chiropractic is not only about pain, it's about optimizing your body function in many, many, many different ways.
That's great. That's perfect. And that's why we go together so well as occupational therapists, physical therapists, chiropractors. We really complement each other. Okay, so you and I met because you saw that we are pelvic floor specialists, right? So, and I found that you do a fantastic job with those women who are either pregnant or they're postpartum. Tell me, or tell them, what you would do for women who are having a lot of the hip pain, the pubic symphysis, back pain. How can you help women?
Yeah, so I think that's very, very important. What you said just right before is that we work together. Yeah. So there is another big misconception that chiropractic doesn't have good relationships with other professions. And I want to say that in my office, that is completely untrue. And so with that question in mind, what we're doing in the chiropractic realm of people who are having hip issues, pelvic issues, sacrum issues, especially those expecting moms, is we're using a technique called the Webster Technique for expecting mothers. The Webster Technique is specific for expecting moms. There's no contraindications to being adjusted while pregnant, but the Webster Technique is kind of the gold standard. And we're looking at sacral function. We're looking at round ligament balance. We're looking at hip flexor balance. And we're making sure that first and foremost, the nerve system is functioning with the body as best as possible. So if we can bring in that nerve system component, if we can bring in the soft tissue component, if we can bring in just that joint movement component, then we have an opportunity for the body to be under less physical stress and for that pregnancy, labor, delivery to be much, much easier. But with that, taking that into consideration, there's also that component that, thinking postnatally, that your world is one that I like to send into, because you're thinking more differently about what's going on than I am.
Sure.
So that's why that combination is so important, and being able to see multiple specialists, whether it's pelvic floor therapy, PT, OT, chiropractic, and they all kind of combine to create one beautiful harmony of care, so that your proactive care can be so much better, and then you're not reacting to things that are happening to you on a daily basis and trying to quote unquote get healthier when you can just stay healthy instead.
Yeah, that's a great mindset, and probably much different than our current healthcare system, but
absolutely.
I love it. Okay, and then we also had a conversation a few months back about how you help kids and children who might have gastrointestinal or constipation issues. So can you tell them how you do that?
Yeah.
I thought that was fascinating.
Yeah, so kids in general, you have a different mindset about, because you're not going to have your 2-month-old go, mommy, my back hurts, So, and that's why I kind of wanted to start with that misconception of pain is the only reason you see a chiropractor for. But there's a couple of major reasons why we see kids, and kind of the top 4 in my office is, number 1, torticollis.
Sure.
So that is a physical type of thing where that neck's not sitting properly. Maybe it was interuterine constraint. Maybe it was a trauma that happened during labor and delivery. You never know what it was, but well, sometimes you do. But either way, it's that physical component. But then we usually see a lot of constipation, a lot of ear infection type of cases, and last but not least, which is one that you may not encounter or know until later on, is post tongue and lip tie releasing. Okay.
Interesting.
So frenectomies, that kind of thing. But the constipation specifically is a good one, right? Because obviously that nerve system, brain to body connection is telling the body what to do, and it's telling it to eliminate waste. But if there's something going on, low back, pelvic, sacrum area, specifically that's where those nerves come out that go to those organs, right? We call it it's subluxated, and we call it a poor plumbing. Okay, so kids can't get that stuff through, right? And kids are supposed to be pooping multiple times a day, especially when they're being breastfed. And if they're pooping 4 times a day, that's cool, that's awesome. But we get those clogged systems, right? And it's the poor plumbing. And specifically, what we're really good at is getting that nerve system, to make sure that nerve system is working well in order for the pooping to occur, the bowel movements to occur. Now, there are special cases where it's not chiropractic, and if we have some kid that comes in that it's something that's going on within the large intestine, maybe they were premature and something hasn't developed properly, well, then it's not a chiropractic case. But if we can do our spinal scans, which we do in the office, and see if there's some obstruction with the nerve system in that area, well, we know we may be a good candidate.
Perfect. And then, of course, our men. So a couple weeks ago, I had that question for you. We do have our males who are suffering from difficulty obtaining erection or actual erectile dysfunction. And we were chatting a little bit how you could possibly help them.
That's one that we'll call it a side effect. And in most contexts, the side effect is a bad thing, right? When we think of the medical paradigm, side effect is usually bad. But in this case, side effect of getting adjusted is sometimes a good thing. And So we'll have a male that comes in, maybe has some low back pain, right? And we're focusing on the low back. Well, lo and behold, the same nerves that go to the muscles of the low back, that go down the leg, whatever it is, are also those same nerves that go to the large intestine, the small intestine, the reproductive system. And so sometimes we get a side effect of someone being able to obtain what they've wanted to obtain for a long time that they haven't been able to obtain for a long time.
Excellent.
And so you usually don't find out about that one. So most of the time guys go, they don't really tell you about that on the first visit, right?
That's not necessarily why they're coming to you.
No. But lo and behold, visit 4 comes along and they go, hey doc, like, just wanted to let you know, like, sexually with my wife, and it kind of starts out in that kind of slow context and manner, but they're able to have a more pleasurable experience. That's awesome. And sometimes it's erectile dysfunction. Sometimes it's an adult is also constipated, so it's not just kids, right? So those side effects in chiropractic are sometimes a great thing, and they're usually not talked about or discussed until they actually happen.
Right. Yeah. And then my last major question is, how can we, from your point of view, I know there's a stereotype that you guys deal with joints, how can we protect our joints? How can we protect what are the top 3 things that we can do to protect our physical bodies from your point of view?
Okay, so I think first and foremost, we have to think about motion as life. Okay, so movement is always a great thing. Okay, once we find that person who breaks their hip when they're elderly and their motion goes down and their movement goes down, our health deteriorates very quickly. So I'd say first and foremost is movement. Exercise, weight bearing, some exercise and weight bearing wise, like lifting some weights, but also the cardiovascular types of exercise. Okay, and we can get into so many details of how you exercise and what's the best way to exercise, but I just give it as movement is life. Okay. Number 2, I would say is diet related, and diet related things are everybody has their own way of eating. I eat paleo, I eat keto, I eat I do intermittent fasting, I eat a standard American terrible diet where you're eating cheeseburgers from Burger King all the time,
and everything has additives in it, and
so nutrition is always one that has to be thought about and is very important. And now we're getting more holistic, right? We're not getting just specific on chiropractic, we're getting more holistic with everything. But and lastly, I do think chiropractic care, like I told you, is such a good foundation for health, joint wise, nerve system wise. When we're doing these adjustments, we're really focusing on stimulating the nerve system. So proprioception is a huge thing within the body, and when you increase your proprioception, your nociception or pain levels go down, and they kind of work back and forth. So we want to increase that proprioception as much as possible. And so I think chiropractic care is 1, the foundation to it. Number 2, the diet is very, very important, and 3, motion is life, so stay moving as much as you possibly can.
That is fantastic. I love it. Yes, I love that. And I do have one more question that I just thought of, and it's kind of a funny question. Okay, so when I was growing up, they would always say, don't crack your knuckles, don't crack your knuckles.
Correct.
Is that true? Like, does that cause arthritis or any other bone issues?
No.
Okay.
There's some sort of study out there, and I'll have to look it up and get it back to you some way. But there's a guy or a woman who they did x-rays on hands, right? And it was I don't remember how long it was, so don't quote me on this. We'll say we'll say 5 years. There was a study where they x-rayed hands on a certain time basis, both hands at a time, and on one hand this person cracked their knuckles on a daily basis, and the other one they didn't at all, which would be really, really difficult.
Sure.
And they compared that throughout the time, right? And they showed no joint difference.
Interesting.
Okay, so the whole degeneration type thing. I mean, I would say the caveat to that maybe is if you're trying to force things every 5 minutes,
Sure.
maybe you have a
Not
little
a good
bit
idea.
of a stress problem,
Mhm.
and you need to like
Some other
find a
coping
way
mechanisms.
find a way to lower it, whatever that might be for you. But you may need to find a way to lower it.
Okay.
Go hit a punching bag or something,
Yeah,
right?
something else.
But yeah, I think that that's a good way to think about it.
Okay, and when you are doing those adjustments,
Correct.
the sound that people hear,
Yes.
what is that?
So it's called a cavitation.
Okay.
We call the movement an adjustment, right?
Mhm.
And the sound that you hear is called a cavitation. And what the cavitation is within our joint,
Mhm.
there is fluid and there is a gas.
Okay.
Okay. And when that gas gets released through that joint space,
Mhm.
you hear the sound or the audible called the cavitation.
Fascinating.
So it is a gas release from a joint.
How interesting. See,
Yeah.
I learned something new. Okay.
Every day.
Thank you so much, Ryan.
You're welcome.
It was fun.
Absolutely.
All right, we'll see you guys later.
Have a good week.
Again, it's Ryan Wilk at Ryno Chiropractic, just up here in Peoria off of Lake Pleasant
In
and
Happy Valley,
and
right
Happy
behind the
Valley.
Sprouts for all of you locals.
That's right. All right, bye you guys.
Take care.